Well, good afternoon and welcome to GPA Live, the virtual educational broadcast brought to you by the Global Pain Association. It's a brand new year still with a brand new name, GPA Live. And as we get underway, I'd like to ask those of you who are watching us on Facebook Live, please share this broadcast, especially because this is a special Valentine's program for you and your significant others. So share it widely, and we'll get more and more folks interested in what we're doing here on GPA Live. Today's topic, intimacy and chronic pain, putting the spark into that relationship, no matter the chronic pain that an individual may be struggling with. Our special guest is Dr. Marianne Pinkston. She's a pain warrior and the facilitator of our new GPA Warriors support group. And we've had a tremendous support for that support group, and we appreciate that. We want to thank Advanced Pain and Spine Center for supporting this segment of GPA Live. They are fellowship-trained physicians specialized in treating acute and chronic pain conditions. Advanced Spine and Pain Center offers on-site pain management with advanced non-opiate procedures and multidisciplinary treatment plans. There are 3 locations: the Texas Center for Athletes, Westover Hills, and Stone Oak. We invite you to go to their website at www.advancedpaindoc.com. Advanced Pain has made this program possible. We appreciate that. We'd like to welcome now to our GPA Live broadcast Dr. Susan Blackwood. Susan is the president of the Global Pain Association, and she is the one who made all of this happen. Susan, good afternoon.
Well, thank you, Ron. And again, thank you for moderating this incredible series. We now have over 60,000 people that we've reached out to and that have been following us, and hopefully they'll share this one. I've had a sneak preview with the segment, as you know, and I'm really excited about this week's topic. So thank you so much, and to the Eisenberg Group for producing this time and time again. Since last May, this has been an incredible opportunity for us to reach out to the community and to establish relationships with organizations like Advanced Pain that we never had before. So thank you again, and I look forward to the segment and getting back with people and telling them how they can get involved with the Global Pain Association.
Well, we thank you for making this possible, and to the board of directors of the Global Pain Association for committing to do this every Saturday at noon. And we look forward to the incredible guests we've had. You and I and others have learned so much. And I thought I heard you say we have something like 60,000 people who are now following us.
That's right, Ron. And towards the end of the show, I'm going to tell some of those followers how they can get some free prizes.
Ooh, I like that. That's a tease after we hear from Dr. Marianne Pinkston. Thank you very much, Susan. We'll talk to you in a few minutes. I want to take just a moment and introduce our very special guest. You've seen her before on GPA Live, Dr. Marianne Pinkston. She's the owner of Pinkston Medical and Wellness Clinic, a family practice and integrative medicine specialist, a board member of GPA, the Global Pain Association, chronic pain sufferer herself with rheumatoid arthritis, so she knows what it's like to battle pain. She is a hormone replacement specialist and a weight loss program director. It's hard to believe looking at her. She lost 162 pounds even while suffering chronic pain. And congratulations for doing that, Dr. Pinkston.
Thank you.
Now, we have a great topic today that you came up with, the whole question of intimacy and chronic pain. Look, when everything hurts, you're not looking forward to somebody touching you.
This is so true. And thank you guys so much for having me on again. I really love doing this series. So I truly, truly appreciate all the time you guys give me. And this is a great topic. And I really wanted to do this for a very specific reason, not just because it's Valentine's Day and cold and cuddle weather outside, but because this is truly very, very, very important. And I can't tell you how many times I have patients who come to my clinic, not in chronic pain even, who need to talk about this subject, but feel very inhibited to do so. And it's an embarrassing topic to people. It's big stigma. Patients really feel like they have something that they have to hide. And we talked about before, you and I were on that, patients oftentimes will have a long, good conversation in our appointment. As I get up to walk towards the door, put my hand on the doorknob, it's, hey, wait, doc, I just need that prescription for that little blue pill, or can I ask you a question? And then, that's when we finally get started and open up the subject. So this is a great opportunity to bring this topic to light, not just for chronic pain sufferers, but for all patients who
Well,
need
let me
help.
invite those who are already with us
Sure.
on Facebook Live to share this broadcast.
Please.
We'd like to see Linda and Alice share the broadcast. Lisa, share the broadcast. Easy to do. Just click share and you can send it off to all of your Facebook friends and we'll get more people involved. Dr. Marianne Pinkston, our special guest today, talking about intimacy and how that works when someone is struggling with chronic pain. And, Dr. Pinkston, how many times has someone heard, "Not tonight, dear"?
Right. That's why I put it up there. And Ron, please feel free to interrupt me as I ramble on here. If there's any questions, you had some good ones yesterday. And so, yeah, not tonight, dear. I have a insert, excuse. And it's not an excuse. And I want people to understand most of the time there really is a true reason why people do not feel like being intimate. And it's, besides it already being a stigma, I think this is a subject that is hard to open up about. And the communication lines are what is missing between doctor and patient, or, the patient and their partner, their significant other. And so whenever, patients are having chronic pain, don't feel well, when they say not tonight, I don't feel well, oftentimes their partner, their spouse feels very, very rejected. So I want to open up this topic so that people understand why chronic pain lends itself to a frequency of, not tonight. And I think that there's patients when they have chronic pain feel like they may further injure themselves. They already have injuries. They already have pain. So if I get involved in something, exercise driven like this, maybe I'll hurt myself further. Or, the lack of desire is usually the largest problem. It can be something hormonal. It can be that, you're just under too much pain. You're under the influence of medications at night, many different reasons for that. I can't talk to anybody about it. It's something that is great in a great way becoming a thing of the past. I think lines of communication are starting to open up. I think it's my younger patients who are oftentimes very easily to open the subject, but my older patients sometimes are not. It's something that can be very embarrassing. And it's important to remember, sex and intimacy really are natural painkillers and a natural antidepressant. So it can make you better. It's something you should definitely try to make yourself and your life better for you and for your partner. So I put this quote in from an internet site. It says, "Sexuality helps fulfill the vital need for the human connection. It's a natural and healthy part of living and contributes to your personal identity." And that's such an important statement. Sex is a normal, important part of relationships. And it's something that when it's absent, either you've been together forever, or you're sick, or whatever, the spark is lost, that is something that disappears over time. It's very, very important that we remember we have to keep this alive. There is no age limit. So this is where we discussed yesterday a story of a patient, a couple of patients of mine, a couple. So they're in their mid to late 70s. And came to me. They've been married forever. They had their 50th wedding anniversary, which you don't see very often anymore, but had their 50th wedding anniversary. They came to me and said, Dr. Pinkston, are you kidding? We don't hold hands. It was the wife that was mostly complaining. She said, he never gives me flowers. We never hold hands. We never engage in sex. Why would there be a reason to do that? And I was trying to talk to them both about hormone replacement. And she said, why? I've just given up on that. And I gave them a challenge. I said, I bet you anything. I forgot what we betted, but I said, I bet you anything we could get your relationship, back, and I can rekindle that spark. So they let me, do the hormone therapy. It was about 3 months. They came back for a follow-up. And she was all a grin. They were so cute and so happy. She said, Dr. Pinkston, you changed our life. You changed the direction of our relationship. She said, we hold hands everywhere we go now. He gives me little gifts and kisses and flowers. And she said, now when we lay in bed at night, instead of just turning off the light, turning our backs to each other, we'll turn on a movie, but we never finish the movie. And I really thought that was such an incredible story to share. They're in their late 70s. And that if they live just one more year, that to me is quality of life. So there is no age limit. And pain shouldn't limit you either. So please don't use that as an obstacle for yourself. I would say excuse, but I don't think it is an excuse necessarily. I just think it's a huge obstacle that patients need to overcome. And if you understand the way that the body works and your body chemistry, that you create endorphins, and those improve and enhance your brain chemistry. It treats depression. It improves your self-esteem. I mean, when you have your mojo together, you're able to, fight the world, especially together when you're with your partner. And it is a form of exercise too. So you've got to count that in your calorie burning for the day,
There's another flip side to that.
Yeah.
I was going to say there's another
Sure.
wonderful flip side to that. Some people go out and run miles and miles and miles to produce endorphins. What you're saying is a little sex will do it. You don't have to run.
You don't have to run. No, you don't. And you don't have to spend hours doing it unless you want to. But it is definitely something that will create wonderful endorphins for you. And it takes very little time or effort, really. And so what is holding you back? So pain, obviously, is what we're talking about today, chronic pain. But medication side effects, people don't realize what medications can do. It can kill your libido. It can make you fatigued. And it make you sleepy or, unable to perform, erectile dysfunction. Mood disorder. So if you're just depressed or have an anxiety disorder, I find veterans with PTSD or women who have postpartum depression, the low hormone levels, this is the biggest one. So estrogen and testosterone both. And testosterone is not just for men, it is for women too. It's just that men and women require different levels, but that is oftentimes the very key, starting in your 30s, really, that is the very key to loss of sex drive, is loss of testosterone levels. And it can be done very safely, replaced. Social issues. So, you can be inhibited by those stigmas out there that, you're 70, you're not supposed to be having sex. Well, yes, you are. And oftentimes that Alzheimer's wards, I saw a funny movie last night that made reference to the fact that, patients, when they lose their inhibitions in their 70s with Alzheimer's and whatnot, turns into kind of a wild, nurses have told me it turns into a wild fest sometimes after the sun goes down, that it's really, there's no loss of sex drive when you get to the basics of how our brains work. But there's a lot of social issues and stigmas that keep us from it. Autoimmune disorders. So fatigue, that's one of the, you have a lot of pain when you're autoimmune, your body's fighting itself, but you also have incredible fatigue. So I will find that patients, and I know this happens to me with exercise, and I'll have a great day. I feel wonderful. I get a lot done and I will overexert myself. And then the next day or two is a total wipeout. So I think sometimes patients know that if they have a great evening with their partner in bed, then the next day they're going to get nothing done. So why make the event happen at all? Erectile dysfunction or vaginal dryness. Those are things that definitely inhibit people if it's painful or if it doesn't work, then, or things like positions. If people are afraid to go into certain positions or whatnot, that might be more painful. So those are some of the things holding people back.
But can't you treat vaginal dryness and erectile dysfunction?
Absolutely. So there are a lot of treatments. There are times where there are situations where I'm not able to treat, but that we'll get into that here in a few minutes. There are ways around it. And that's why this portion right here is the slide is so important. Talk to your doctor. So if you have erectile dysfunction, don't be embarrassed. I promise you, go sit in a room full of men and every other one of the men around you have this problem or vaginal dryness, the same. It's just nobody will talk about it. but you can come talk to your doctor. It's our job. And I know it's a strange subject. I know we've got 15 minutes there. I know you just, came out of the waiting room and you're not really in that mode, but, be prepared with a list of questions. Come talk to me about it, or your doctor. We understand this and we are not embarrassed by it. I know patients are, but we are not. And this is our job. So what I'll discuss with people is maybe a change in timing of pain medication, if that's something that inhibits you, or if it's something that helps you, time it an hour or two before you have sex. Change your medication if that's something that inhibits you as well. I know a lot of blood pressure medications can dampen erectile function, or it can cause people to be fatigued or depressed. So we can change up those medications. Hormone replacement, it does not cause cancer. It is not unsafe at all. It is an extraordinary help. It saved my life and many of my patients' lives around me. And then bring your partner to your appointment. I don't know if you've ever thought of that, but I've had people bring in their husbands and say, can you please explain to my husband that it's not that I'm not attracted to him. I just have a problem. And I need you to help me explain this, and then help him understand that there are ways around it. Maybe they don't want to pay for hormone replacement or something. After we talk, then they see that as a priority. And then counseling. There is a lot that counseling can do for patients if there's some sort of psychological problem behind it. But we can also talk about intimacy. We don't have to talk about just the functional parts of the body. We can actually talk about intimacy and the importance of being resourceful and working around the obstacles. There's you've heard it, there's a million ways to skin a cat. So we can talk about those things, and I can help you with different ideas.
All right, let me jump in real quick. When
Please.
you say change medicine, do that with a consultation with your doctor. Don't just switch your
Yes.
medicine.
Thank you, Ron. Yes, absolutely. Don't just switch your medicine. But that's what I mean, under that heading of talk to your doctor. I can change medications with you.
Right.
Absolutely. So
Now,
we can,
for folks who just joined us, we've got a ton of people in our chat room. Remember, please share this broadcast.
yes,
Just click share at the
please.
bottom of the page, and we'll get a whole lot more folks who can get help here. Pre-Valentine's, we're going to get the spark back in come Valentine's Day. And Marianne, this is
wonderful
all
timing.
interesting. This is
Good,
interesting
thank you.
stuff.
Good. I'm glad. This is so important. So yeah, okay, the embarrassing stuff. So I do talk to patients about things. When I say use your imagination, I really mean that. If people imagine, sex and imagine that, it's going to hurt, it's usually a positional thing or whatnot. So use your imagination. You can use different positions. You can use different situations. That's why I use the toys and tools as well. Lubricants or toys. Many people, feel like, well, they have to walk into a store somewhere and show their face. And well, now you have masks these days, but show your face and talk to somebody. And that is true. These stores and whatnot out there, really, they do understand these problems. They do have some training about difficult situations. So they're not just there to, just to be kind of the butt of everybody's jokes. They really do have a job. The other thing too is now online you can order, you can go on, nobody knows you're on, you can order things, it mails to your doorstep in a box that doesn't have a sexual toy all over the front of the box or anything. It's very, very discreet, so your neighbors don't know what's going on. And the things that they have really do, when you go online, it explains what problem it's trying to solve or what purpose that it serves. So there's a lot of explanation, a lot of information. The internet is wonderful. And when you put something on your credit card, it doesn't say the sex shop or something on it. It's all very discreet. So you can look at things, and if you are not able to perform for some reason, well, don't leave your partner to wonder what being intimate would be like. Just order something and a toy or something, get around that. nobody is perfect. So this is more of a body image, thing. When you are in a lot of pain, maybe you have to wear a brace. Maybe you are missing a limb. Maybe you have deformities from arthritis in your joints. Maybe you've gained some weight. It's been a long time since you've been able to exercise. You've gained some weight. I promise you, nobody cares. Turn the lights out. It doesn't matter. Your partner is not perfect either. None of us are. Drop the expectations. I promise your partner would much rather be with you and enjoy you than be without you because you're embarrassed over something. It doesn't matter. They love you. They do not care about those things. No, you're not going to further hurt yourself. If something is hurting your body, your body's going to tell you. So, always make the jokes. You go to the doctor and you're, moving your finger and you say, "Doc, it hurts when I do this." Well, don't do that. It's the old joke. So if something is hurting, your body's telling you don't do it. So don't. Change positions, do something different. And medications are great. There's medications for your sex drive. There's medications for erectile dysfunction. There's medications for vaginal issues. Mostly it's hormone replacement. And so those are things you can, talk to us about. We can definitely treat that. And it's not 100% always, but there's always a way around it. And we know a lot about these things. So it doesn't have to be embarrassing. So does avoidance make things worse? Yeah, it sure does. So if you're avoiding sex, with I think the main thing that there's, two takeaways from this that I want you to get. And one is your partner, your significant other will feel undesirable and unattractive. It affects your relationship with your partner. This is one of the biggest reasons I think that marriages end is over, a situation where they just feel like their partner just doesn't love them or find them attractive anymore. Or that's the reason why people find other relationships. The other thing too is it affects your own self-esteem. I think sometimes when we're under tremendous stress, so if we've lost a job, if we have, failed, men, if they fail to provide by losing a job, or, there's some sort of big event, they lose a leg, or, these stressors and whatnot, these are things that make people avoid, wanting to have sex. And so you've got to understand those stressors. Yeah, they're important, but a lot of times having a good relationship with your partner, a good sexual relationship relieves stress. So try to look at it in a little bit different way. If you're too fatigued, you've got to communicate about those things. You've got to tell people that you're feeling tired, and it will make it worse if you don't exercise, if you don't move, if you continue to give into that fatigue. Those are things that will definitely make it worse too. And if you understand you're under a lot of stress, you have a lot of fears, you have self-esteem issues, your partner does too. Your partner is also afraid to hurt your feelings as well. Maybe they're going through something. Please communicate about those things and get rid of the stigmas. There's stigma. What do they say? A stigma is a stigma for a reason. You chose your partner. Your goal is, you have to look at your goals for what you're trying to accomplish. Are you just in this situation to have sex and just have an orgasm and just go? No, you are in this because you love this other person. So you have to remember and rekindle those things. And you are there to share this love with your partner, but you're also there to improve your quality of life. And it doesn't matter what age you are. That's very, very important. So that kind of lands us a little bit further in the communication department. So yes, I've said it over and over. I'm going to say it 1,000 times more if I have to. Talk to your doctor, talk to your professional, your nurse practitioner, your PA. It's not just your doctors. We are all trained at this, but we also are trained in life. We've all lived our lives as well. We've all been in these situations. It's time to just sit and get real about it. Talk to your partner. They will understand a lot more than you think. And that line of communication is just too important. Get treatment, try new things, stop putting limits on yourself, and listen to your partner's concerns, listen to your own concerns, and we will too. Doctors will listen to you. We will help you with that. And if, now that we've talked about it, now that everything's out in the open, you definitely can rekindle the spark. It's a wonderful thing. It's a wonderful addition to your quality of life. If you have made some adjustments, look at what your goal is. If you are just there to, rekindle the spirit and get closer to your partner, you're also there to feel good and improve your self-esteem and your body and things. This makes people get out and exercise. If you know you're going to be, having sex more often, you want to look better. I think it gets you up and gets you out, makes you exercise, watch your diet a little bit more. I mean, it does nothing but improve you for the long run, right? Definitely plan ahead. If your energy runs out after activity, and it's going to be one of those things where you really give it your all tonight and tomorrow you're going to be down for the count, well, plan ahead and just let your partner know what's going on, and people will understand. You would do that for other activities. If you were going to go to the fair tomorrow, that the next day is going to be trashed, well, then plan ahead for that. You would do that for every other activity. And then, we'll open up the things about talking about, ideas and medications. Be sure to include your partner in that discussion, and whatever actions that you're taking, include them. And really, this is all about doing better things for yourself. You really do deserve a better life and a better quality of life. And that's what this is all about.
Well, as one of our
That's it.
listeners just commented, you are
Mhm.
amazing. That was a wonderful
Oh, thank
presentation.
you.
And put the
Thank
spark back
you.
in, right?
Put
Get
the
with it.
spark back in. Absolutely.
Now, Marianne, your phone
Absolutely.
number
It's
is
so
on the
important.
screen. If folks want to
Mhm.
call you and come talk to you, are you seeing new patients?
Absolutely. I
Cool.
am seeing new patients.
Dr.
Yes.
Pinkston,
Thank
thank
you.
you
Would love
very,
to have
very much.
people.
Member
You're
of the
very
board
welcome.
of
Thank you. I appreciate
GPA,
it.
and she also facilitates the Global Pain Warriors support group. We thank you, Marianne. That was wonderful. I want to thank the folks at Advanced Pain and Spine Center for supporting this segment of GPA Live. They are fellowship trained physicians specializing in treating acute and chronic pain conditions. Advanced Spine and Pain Center offers on site pain management with advanced non opiate procedures and multidisciplinary treatment plans. There are 3 locations: the Texas Center for Athletes, Westover Hills, and Stone Oak. Go to their website, www.advancedpaindoc.com. And again, we thank them. And we're looking for other sponsors as well, which is a great opportunity to welcome Dr. Susan Blackwood back to talk about getting involved with the Global Pain Association. Susan, once again, it's great to see you. We appreciate all the work that you have done on behalf of the Global Pain Association. Thank you so much. And we are looking for more sponsors, right?
Oh, absolutely. Advanced Spine and Pain have been there for us since day one, but we're looking for more people that want to sell their products, their services, their organizations to those people watching and that need those kinds of resources. And I want to thank Dr. Pinkston as well. That was amazing, and she does a great job with our support group. What an amazing board member, like all the other volunteers on our board, myself included. It takes a lot of time and effort and resources to be able to make an organization like this go. And when it comes to resources, no dollar amount or no donation is too small. We take donations on our website by going to www.globalpain.org/donate. And if they want to sponsor, there's an opportunity on the website also to sponsor, or they can call me. And my telephone number and contact information is there. And we'll get them involved. We've got series going through the end of May. And then who knows, we might get to have a session in person. We're looking forward to that as well. Now, for those people that are watching that really, really want to show off their interest in Global Pain Association, for 3 winners, we have our Global Pain Teal beautiful t-shirts with our logos.
Very
In
attractive.
addition, from our sponsors at HEB, a $10 gift card that will mail out to the first 3 people that indicate that they'd like to be a winner. However, we need to mail it them to them. We're still on the pandemic and I can't deliver them. So on our Facebook page under private message, if they would send us their name, their physical address, we'll get it out to them right away. We have medium, large, and extra large if they'll tell us what size t-shirt they need. And again, don't forget that $10 HEB card. 3 lucky winners, Ron.
So the first of you who jump on board, go to the Facebook page where you already are. If you've been watching this program, click private message, send a message with all the information, and we'll get those to you. And that's a really pretty teal color t-shirt. It can be yours if you're one of the first 3 to jump on board. And Susan, a final word or two for folks who are interested in volunteering to help the Global Pain Association.
Well, of course, Ron, besides the donations and the sponsors, we do need volunteers. We've had student volunteers. We've got some students from Incarnate Word that have volunteered for this term as they finish their physical therapy training. So in all aspects, we can use volunteers that will help. And if they'll just reach out to us at an info@globalpain.org, we'll get them information on how they can register to be a volunteer.
Dr. Blackwood, thank you very much. We'll talk with you again next week on GPA Live. Thank you. And speaking of next week, next Saturday, February 20th at noon on GPA Live, the topic is medical cannabis. So we're not smoking it. We're talking about medical cannabis right here on GPA Live. On behalf of the board of directors, thank you to our executive producer, Gina Eisenberg. Thank you to Susan Blackwood and all the members of the board who make it possible. We'll see you next week on GPA Live. Have a warm weekend, everybody, and happy Valentine's Day.